I wanted to give each of our panelists an opportunity to give us like one great takeaway from this conversation, something that all of you guys should think about as you go home and that you guys have thought about as a result of this conversation. And Phil, if you don't mind me putting you on the spot, will you start us off?
Sure. Well, I'll just say again, health reform is hard, and the more expensive and the more disruptive it is, the harder it is. It's just the fact of life. So in the short run, I would say it's a big lift. In the longer run, we'll see.
Adam?
On a slightly more optimistic note, I think one thing that makes healthcare reform a little bit easier is the fact that the money is already there. We're already spending the money. We just need to spend it smarter in order to be able to cover the uninsured and cover the underinsured.
John?
The principal pain points that Bob articulated so well can be addressed in the next Congress in a way that doesn't require 60 Democratic votes in the Senate. We can fix this and address some of the critical issues that are most hurting Americans. If I were to say I got to put all my chips on the table for one thing to do in 2021 if Democrats control all three, climate change. That's what we got to do. That's a global threat to humanity and to all the other species we like to hang around with, and I think is a need to be strategic and important. And climate change is very much about public health.
Sara?
So I agree with Bob, and that people's concerns are about their healthcare costs, and there are things to do that we in Congress could do tomorrow to improve that. They could expand enhance marketplace subsidies, fill the Medicaid coverage gap. Do little things like that would actually help millions of people better afford their coverage and able to get covered for the first time. I think there is somewhat of a disconnect between the other part we're talking about, which is lowering the overall growth rate of healthcare spending, and by really addressing that provider price issue that these plans are doing. But I don't think that the public can really see that connection, that those are driving their current cost concerns. So it's a matter of public policy, and it's important for us to talk about it, but consumers don't necessarily see that linkage.
Bob?
As simple. Over the next 10 years, polls are not going to matter. What's going to matter is who's elected to office. And these are visible issues. Candidates will be running with across their sweatshirts for plan A, B, or C. If you want the outcome to look different, it matters who's elected. And it's not going to be resolved by either a study or a poll or anything else. We are in a situation where who wins will determine the end of this debate.